Hi, my name is Karen Crampton. I am a social worker in the home dialysis program at the University of Michigan, which is also a partnership with Fresenius.
And hi, I'm Kayla Jones. I'm the social worker, in-center chemo social worker at University of Michigan.
Thanks for joining us today. And I'll start with a question. What if we could get as many eligible transplant patients listed as possible? And that's always our goal. And today we want to talk about the strategies that we can use to expand access and increase kidney transplant listings. If you have ideas that you find helpful in your clinics, please feel free to put them in the chat for us to see and benefit from. I'm going to start with the current state of transplant. And in January of 25, only 13% of patients with end-stage kidney disease were on the transplant wait list, according to the USRDS. So let's talk about strategies to improve this percentage. So why is transplant important? And as you know, we have to provide modality education, including transplant, at least annually. And during that time, we should obviously be sure patients understand that there are risks and benefits overall, that we want them to know transplant offers a better quality of life and increased life expectancy compared to dialysis. So now I'll turn it over to Kayla.
So the next question becomes, how do we help our patients get motivated to work towards transplant? For many of our patients, this can seem overwhelming and unreachable, even before they get to that first appointment. As dialysis professionals, we're in a special spot to help our patients work through these barriers to give them the best chance of success. But to do that, we need to first understand what our patients are already thinking about the process. Now, most of us have some familiarity with this process of being listed for transplant. But we have to remember that for our patients, this may be entirely new. They may have heard from others or researched online, and this can shape their expectations in either a positive or negative light. Here we've listed some of the myths that our patients have mentioned before, but I'm sure we can come up with plenty more. If we take the time to understand where our patients are coming from and dispel these myths, we can set realistic expectations for what the process is really going to be like. Keeping an eye out for transplant red flags in our patients can help us set realistic expectations and encourage their progress towards transplant. Most centers have similar requirements to be listed, which are in place to ensure patients will be able to handle the strict follow-up necessary for success. Of course, we'll still have some patients who are ineligible for transplant, and we can play a really important role in helping those patients grieve and adjust to the news. But today, I'd like us to focus on things that our patients can address, which is actually a majority of these items. And especially if we know about these things ahead of time, we can help patients improve their chances before that referral is even sent. Let's look at some of the ways we can help set up our patients for success. So frailty can be a huge barrier to our patients and because this affects as much as 30% of our patients. This has been shown as a strong predictor of outcomes post-surgery, though many patients may not fully understand why it's keeping them off the list. Transplant centers often assess this with a functional status test, including walking up and down the hallway or going from sitting to standing multiple times. Additionally, those who have limited mobility have higher risks of falls, hospitalization, depression, lower energy to complete tasks, and decreased nutritional intake, among others. So this may not just be a barrier to transplant, but to a good quality of life overall. Weight is also a big barrier to patients being listed, as a high BMI or too much fat around the midsection can make the surgery and recovery more difficult, therefore lessening their chances of being listed. But we can help motivate our patients to take small steps to improve this area. I recently heard a physical therapist say, "The best exercise is the one you'll do." Physical therapy is a great tool that we can refer patients to for guidance on how to improve their overall mobility and gain confidence in working towards this goal. Another thing that can make a difference is rallying the team together to address other barriers, like medication side effects or difficulty with nutrition. Think about it this way. If a patient is getting what they feel is conflicting information on what to eat or not eat, it makes it really hard for that patient to make the right choices. A patient's social supports can have an especially important role to play throughout this process. It really comes down to who the patient knows and what we can do to encourage them to further their connections. Many of our patients may feel shame about their diagnosis and not want to share, but something I like to tell my patients is that we're not meant to go through these things alone. I had a patient recently who was very hesitant to talk about their health and was struggling to solidify a support plan for transplant. However, when we talked through their concerns about how to address it with family and friends, the patient found that having the conversation itself was actually much easier than they expected. Having a solid support plan is vital for transplant patients in order to be listed because of how much help is needed after the surgery, like managing medication and driving the patient to multiple appointments every week. Some transplant centers have been able to get patients approved for nursing home or rehab placement after the surgery, but this is rare and may require an out-of-pocket expense. If a patient has difficulty naming who's in their support system, I like to ask them to walk me through a typical week, and together we can point out places and people they're seeing on a regular basis. Another option, if the patient is still struggling to identify support, is to encourage engagement with hobbies or similar interest groups. This is a quick and easy way to form connections while also getting the patient to be more active in activities that they enjoy. Once we have a better idea of who the patient is connecting with, we can encourage the patient to consider how to get them more involved. Social supports can really help keep a patient motivated to make positive changes and maintain those changes over time. If the patient is comfortable with it and your clinic allows it, consider having a close family or friend join the care plan meeting or attend treatment with them one day. Making these connections and involving supports before the transplant referral will make it easier to recruit them to help in the recovery process after the surgery. Many hands make light work after all. Living donation is another reason why it's important to encourage engaging social supports early. A living kidney donor can last up to twice as long compared to a deceased kidney donor on average. Plus, the wait time is significantly reduced since it becomes a planned surgery rather than waiting for a deceased donor. Patients may be weary about asking family or friends to consider donating, but providing education about the process and what benefits their loved one may have because of it can help put their mind at ease. This is also a great opportunity to spread the net wide. The National Kidney Foundation provides some really great tips to help patients write up a letter or social media post to share their story and gain interest from others. We've heard stories from patients who are able to get support from unlikely sources like church members or old acquaintances, even Facebook mutual friends. And even if a person isn't an exact match, the paired donation program can help cross-match donors and recipients, so that way more people are able to benefit from this. Another important tool is to be organized. Our patients have a lot of information being thrown at them, whether they're just starting dialysis or have been managing kidney disease for a while. And starting the process of transplant evaluation is no different. Talking with patients about the strategies they use to stay organized helps us to see what's already working and what other suggestions might be beneficial. I often encourage patients to clear out their voicemails and save phone numbers so they know who's calling and can follow up if they've missed a call. It's important to get these routines set up now, so that way when it comes time to be evaluated by transplant or that organ offer call comes in, the patient can quickly respond or call the transplant center back rather than missing an opportunity. Throughout the transplant evaluation, patients will likely attend extra appointments and communicate regularly with the team. So encouraging them to access their medical record on their phone allows them quick access to their team, appointments, and test results. And working through the details together with patients can help them plan for any barriers that may arise or questions that they're going to want to ask. Adherence is a big item that transplant pays attention to, not only their adherence to dialysis and medication, but to medical appointments as well. Transplant centers often use a patient's adherence as an indicator for how they will manage the strict medication routine post-surgery. We want to help set up patients for success by exploring with them why they're missing or shortening their treatments, and working together to brainstorm solutions to improve this area. Even asking the question, what's making it hard to get to dialysis or to stay here for treatment, can help open the door for patients to share what they perceive the barrier to be, rather than assuming what it is. Once a patient's been referred to transplant, the center will often send a form to ask the clinic to report about the patient's adherence or other concerns that may impact their success for transplant. Reviewing this form with the patient can be a good way to enter the conversation, especially if there's an area that is of concern. You then have a full picture to share with the transplant team, or the patient will have a better idea of what needs to be done to improve their candidacy. Education around why they ask these items can also benefit the patients, so they're less thrown off guard when going for that evaluation appointment. For example, while in some states cannabis is legal, there may be factors that impact if the transplant center will require them to quit, like a history of illicit substance use or insurance requiring abstinence in order to be listed.
Thanks, Kayla. So next I'm going to go through a vignette. So it's an informal poll, and just curious how you would handle this situation. So we have Jane Doe is a 55-year-old on hemodialysis for a year. She misses dialysis roughly 2 times a month to care for her grandchild. She takes most of her medication as prescribed, except for her phosphate binder, which she said she just often forgets. Her phosphorus level is 11. The normal range is roughly 3 to 5.5 for a dialysis patient. And she was unsure about transplant for a while and finally said, I think I'm going to go for it. So she asked for a referral to the transplant center. So I'm curious what you would do next. Would you make the referral? Would you be sure she understands that transplant evaluates consistency with dialysis and taking all medications, including her binders? Would you educate her on the long-term risk of high phosphorus as it relates to transplant, or D, all of the above? So drum roll, the answer is any of the above. I think we work toward obviously getting people situated optimally for their evaluation. So I think bringing this up to patients is a beautiful way to just sort of help prepare them for that next step. So I don't think that you could go wrong picking any of those answers. So let's take a look at some barriers to progress. And if you recall, our first slide highlighted that only 13% of end-stage kidney disease patients were listed for transplant. And this article highlights that there is a variation in the workup, which you may have seen from different transplant centers, and that can contribute to inefficiency and inequality in accessing the transplant waiting list and kidney transplantation. So there are multiple factors that contribute to this inequality. So I'm going to highlight some of them and also talk about how we can impact the barriers to progress. The first is mental health concerns. So you can imagine having a mental health concern makes it hard to complete the required testing because sometimes that list is long, makes it hard to follow the dialysis treatment plan, and sometimes to communicate with the transplant team as well if people are having depression, anxiety, and other mental health concerns. So it can help if patients connect with their dialysis social worker for support and resources prior to their evaluation, if possible. That way, when they start their evaluation, some things have already been put in place and it's one barrier removed in advance. So they can engage their support system, use the dialysis team to help with next steps to complete testing. Sometimes that seems insurmountable when there are multiple tests that have to be done. So having some support in doing that can be helpful and help bridge a barrier. And also start and stay in mental health treatment. So we can reinforce that with patients. And I could have also added securing adequate insurance, which impacts candidacy. And for people with mental health concerns, it's a lot of hoops to jump through, as you know, and a lot of contacts and phone calls to try to sort things out, and the ability to sort of understand all of that. So that's a potential additional barrier. So there are other barriers, and I think we'd all agree that these are potential problems that contribute to being listed for transplant. So, the sooner we can identify these problems and address them, the better the patient will be prepared for their transplant evaluation. A significant barrier to transplant is literacy. So let's take a closer look at that. There are different types of literacy. One is personal health literacy, which is about one's ability to understand, use, and act on the information that is provided. The other is organizational health literacy, which is the degree to which organizations equitably enable individuals to find, understand, and use information. So, how do we do that? We can help by asking patients if they have internet access, a device to access information, and an understanding of how to operate their portal, for example. Digital literacy is an additional skill required to use technology and digital media. And many of my patients are given instructions that require navigating one or more health system portals, and they may not know how to use a computer. So, this is a substantial barrier that we can assist patients with and encourage them to inform their transplant team that they don't have digital literacy skills, so alternative methods of interaction could be implemented. One of my patients brought this letter in from a transplant center, and I'll just give you a few seconds to kind of look at some of the words there and highlight that the reading ease of this document is 48.2. And Flesch Kincaid is a program that's built into Word, so it can tell you the reading level of written materials. So another option is to put a letter into an AI program and ask it to use plain language. And this will result in a letter that most patients can understand and act on. So limited literacy is an example of inequality when it comes to transplant evaluation and a good opportunity for us to translate these types of letters for patients so that their follow-up doesn't get lost. And the flesh reading ease of 48.2 tells us that this document is written sort of at a technical level or an academic level, and the reading level for grade is about 10.1. So certainly an opportunity for improvement there. So how can we support patient understanding and access? So as I mentioned, by assessing literacy, we can use tools like the realm, the short form, to determine reading level. I know everybody's really busy, so sometimes a shortcut can be set just simply to ask patients, do you find it easy to read, hard to read, or somewhere in between? And that's not exactly a scientific way to determine reading level, but it will give us a quick snapshot of how patients feel about their ability to read things. And I've also noticed that patients tend to feel less worried about that or embarrassed by saying hard, easy, or somewhere in between. And then we navigate that together. Next is using plain language because we use jargon and shouldn't. So we want to make sure that we are communicating in clear and simple terms. Also applying teach back, which Kayla and I have talked about. It's really an exceptional way to make sure patients have an understanding of what we're saying by having them repeat back the information in their own words. And it is an excellent way to do that. It is also time consuming, which I understand is another concern, but sometimes we don't have to do it for everything. If we can do it for some things, that will help support patient understanding and access. Help with appointments, which I've alluded to before, by providing assistance, having someone help make appointments for patients if they need help doing that. Reviewing the transplant letters, so going over correspondence from the team together. I tell patients bring in letters if you get them and aren't sure what they're saying, and sometimes we're also CC'd on them, so I'm aware of that. But I do reinforce with patients to bring those letters in and to advocate for patient needs, to work with transplant coordinators to help patients access and comprehend materials. On the right is a toolkit by CMS. It's called the Toolkit for Making Written Material Clear and Effective. And it's a good reminder about some of the way we make things seem more difficult for someone who has limited literacy, and is another tool that's available to make things more understandable for patients. Patients can help bridge literacy gaps with our coaching. For example, we can encourage patients to ask for clarification, whether it's with us or at their evaluation. So encourage patients to speak up if something isn't clear to them. Using the teach back for themselves. So invite them to repeat information in their own words to confirm understanding back to whoever they're speaking with. To involve support, and I always suggest including a family member or support person in discussions so that they have more than just their own ears to hear and incorporate information. To request materials, remind patients they can ask for printed information. I send that to patients who have limited digital literacy so that patients have a way to understand what is being advised of them. Now I'm going to shift from literacy and talk about multi-center listing as a way to increase transplant listings. So this includes multi-center listings, which you may know has pluses and minuses. On the pluses side, it increases the range of where a deceased kidney can come from. The waiting time can be transferred once effectively listed or actively listed. And then it's also an opportunity for a second opinion. I have patients who are listed at Michigan and might not be accepted for candidacy at another clinic. So, or sometimes they are multi-listed. So, but the second opinion is an important way to determine candidacy as well. And for minuses, there are some minuses. They tend to be more financially motivated or inspired because it requires additional testing frequently at multiple centers. So you're going back and forth for the evaluation, which can be a financial burden for some. And that includes the travel both before and after surgery as well. Another way to increase listing for some patients is to be sure patients understand the opportunity of being listed for a high KDPI kidney. So I attended a transplant conference last month, and there was discussion about how KDPI kidneys are underutilized, yet could really benefit certain patients, specifically older patients, those that have been on dialysis for a long time, or those with other health issues, which may make transplant challenging. So we should be explaining that accepting a high KDPI kidney can significantly reduce wait times for transplant, but to mostly encourage them to have that discussion with their transplant team. And there are resources for patients and staff that are looking for more information. For patients, the NKF website, as well as the OPTN website for staff education. And this is a sample of what is on, I just did a little screenshot from what's on the National Kidney Foundation website to help people understand high KDPI. And they learn so much at their transplant evaluation that sometimes they forget this information was told to them. So giving them a hard copy of something can be very beneficial. And as we think about expanding listing, one of the things that we can do is think about how our team is doing collectively. So, for example, in a quality meeting, you can ask what's working well and maybe what's not working well. So, what do our transplant numbers tell us? And that'll guide us. So, then we problem solve as a group to make improvements. It's important to work as a team to promote active patient involvement by regularly asking patients about their status, which keeps them engaged in their care. It might even be something that you could add to your nursing assessment, for example, so that the topic gets visited regularly for those pursuing transplant, asking them, what is your transplant status right now, for example. Also, advocating for patients helps create a complete and accurate picture of their health and needs to the transplant team in real time. So there are times when a patient is on hold for a reason that is no longer valid. For example, I've had a patient listed on hold and it said that they were too sick, but they are traveling, doing great, spending time with family. And, transplant wouldn't know that necessarily if one of us didn't reach out to give them an update. And sometimes it's a brief message, a brief phone call, and then they follow up with patients to get an updated picture. So we want to make sure we're communicating changes to the transplant team. Ongoing communication with centers, transplant centers supports coordinated care. So we want to make sure we're doing that as well. And building a routine process for checking and updating your transplant status to our transplant tracking to keep data accurate and current. And this slide is about resources. So we find these useful and thought we might include them in case they're useful for you. Unfortunately, there aren't as many financial resources as there have been in the past, but these can assist with some financial insecurities. I know Gift of Life has some regional grants that people could look into to see if there were any eligible financial resources to help patients with. So food pantries, those sorts of things can help offset financial insecurities as well. This concludes our talk. We appreciate your time. Thank you for spending it with us. Thank you.